Hi everyone, good morning. I'm Catherine Rose Pagrangan, your student nurse from Davao Doctors College. And today, I will be performing a return demonstration of a skin assessment. Skin is the largest organ and the first line of defense of our body against the invasion of microorganisms. Certain diseases manifest its symptoms through changes in the skin, thus giving us valuable diagnostic clues to underlying condition of our client. It should include an actual observation of the entire body, surface including all wounds, inspection of your hair, nails, skin folds, and web spaces of your hands and feet systematically from your head to toe. We also need to check for the needed equipment, including the 8 ruler for the exact measurement, scissors and cotton balls, which are needed for the dressing the covered wounds and ulceration, the pen light for the better visualization, plaster, and gauze pad used to cover and protect the wound after the assessment. Of course, the sterile gloves to protect the patient and nurse from the cross-contamination. And lastly, the alcohol for the hand hygiene and disinfection. The pen and the notebook where I will write and document my subjective and objective data gathered from prior to assessment. So first, before doing the assessment, you should verify what we need to perform. First is to check the patient's chart to read the history of our client. Hello ma'am, good morning. Can I enter your room?
Come in.
So it is important to ask for the patient's consent before entering the room. I'm going to close the door and fix the curtains to secure the patient's privacy. Provide the adequate lighting. Adjust the room temperature for patient's comfort. And I will use the alcohol to prevent microorganisms. Okay, ma'am. Hello, good morning. I'm Catherine Rose Pagrangan, your student nurse for this morning. So, by the way, ma'am, can you understand me or do you want me to speak in Tagalog?
I understand English.
Okay, may I know about your full name?
My name is Keisha Nuevo.
So, what do you want me to call you?
Just call me Kay.
Okay, when is your birthday?
January 20, 2003.
So, is it okay that I'm going to check your wristband, ma'am?
Yes.
Okay. So now it is important that we know that the client can understand us, and it is important to verify for the client's identity and of course to ask the client on how they would like to call during the assessment. So now that you already know the patient's identity or the client's identity, it is important to explain the procedure to the client so that they will know how they can participate during the assessment. So, Ma'am Kay, before that, I'm gonna need to ask you just a few questions regarding your health history so that we'll be able to give you the necessary care that will best suit your needs. That will be alright, ma'am?
It's alright.
Okay, do you have any question, clarification?
None so far.
Okay, alright. So, Ma'am Kay, do you currently experiencing skin problems such as pigmentation, dryness, or swelling, whatever elevate and relates you?
No.
Okay. And are you currently experiencing skin problems? Like, do you have any rashes, lesions, or skin changes you've noticed?
Yes, I have a small wound on my right foot.
Okay.
And it's very disturbing and it's quite itchy.
Okay, and when did you first notice?
Well, I know this 2 weeks ago.
Alright, what do you think happened to that?
Well, I just noticed last week that I had a small light blister and it's very itchy. So I began to scratch it. But then I noticed after 2 days or like that after 2 days, I noticed that it began to form a small wound.
What did you do, or did you put any ointment on it or took medications?
Yeah, I just put an antibacterial ointment because I'm afraid it might get infected.
Alright. Do you have any other health issues aside from that one? Do you have any other skin or diabetes? Or
Yeah, I remember my grandfather had a history of diabetes. Also, I have experienced dermatitis before.
okay, I will take note of that. And you said your grandfather had diabetes. Is there any disease that has ever affected to your family?
No.
Okay, do you know if you are allergic to any food, plants, or medications?
Yes, I have an allergy to certain foods like shrimps and some nuts.
Okay. Do you spend long periods of time sitting, standing, lying in one position?
Not really. I'm usually moving from time to time. I usually change positions. I don't remember that I stand in much longer time.
Okay. So now we're done with the question. We will proceed to the assessing your skin. Is it okay with you?
Yes.
So before proceeding in the skin assessment, as you can see, I am using gloves to protect myself from the client. Now, upon inspecting the skull and the hair for color and conditions, divide the hair and then palpate the skin or palpate the skull. Check for any cleanliness, for the dryness and oiliness, lesions, or the any parasites, and of course, check for unusual growth of the body. So, no, now, ma'am, I'll begin assessing your skin. I will start from your head to toe and just check for other lesions aside from the one you mentioned that you have to your foot. Okay, so let's start. So generally I will see that your skin is consistent all over. I don't see unusual. Okay, I will use this ruler. Okay, and now let me see your hair. Okay, so basically I'm just looking for any scars or lesions which you don't have, and your scalp is intact. Alright, I don't see any headlights or dandruff. Okay, your hair is moisture is good, and as well as texture. So let's move on to your face. I see that your hair is evenly distributed on your scalp and in your eyebrows and eyelashes as well. Okay, you've got 3 flat mole here in the side of your face, about 0.4 centimeters. Okay, you've got 2 ear piercing, 1 on each side. Let's move down to your neck. So this mole, okay, you have not noticed any bad mole in your body?
No.
Okay, your neck is good. I don't see any discolorations. Okay, now I will proceed to the nail grooming and cleanliness, but first I'm gonna remove my gloves. So palpate the nail to assess the texture and consistency to test the capillary refill of the nail beds. Press the nail and watch the color to change. Ma'am, may I see your hand? Okay, you feel warm and moisture is good. Your hand is a bit thicker here. Skin is a bit thicker, your nails. I don't see any clubbing or any abnormal sign in your nail. Okay, capillary refill is good. Can I see the other hand? I don't see hands is warm and you don't have any redness or scars. Okay, the nail is good. Here too, no clubbing and capillary refill is good too. So, is inspected for color variation such as redness, pallor, cyanosis. Skin color can reflect a patient's overall health and give you important information about potentially serious diseases, especially in older adults who are vulnerable to skin breakdown. For instance, pallor may indicate anemia. Okay, your skin is intact and there are no redness areas. While inspecting the skin coloration, note any odor emanating from the skin. The client has light or no odor of perspiration depending on activity. It is important because a strong odor of perspiration or foul odor may indicate disorder of sweat glands. Next is for the moisture. Palpate the skin and check for the skin folds and unexposed areas. Okay, next is for the temperature. I will use the dorsal surface of my hand to palpate the skin like this. Okay, ma'am. Your skin is normally warm and warm temperature. It is important because it is detect the temperature differences between the skin sites using palpation. Next is for the texture. I will use the palmar surface of my hands. Okay, ma'am. Okay, your skin is smooth and even. Next is mobility and turgor. Lifted, fold the skin, noting the usage of which it lifts up to assist for mobility. Noted the speed of which the skin returns into place after pinching the assessed turgor. So, I will ask the patient to lay down using the two finger gently pinch the skin over the clavicle. Okay, pinch, use the two finger gently pinch the skin over the clavicle. Okay, next. Lastly, for the lesions and edema, use the two thumb to press down on the skin of the feet, ankle, or pretibial area to check for edema or swelling related to accumulation or of fluid in the tissue. If none, then don't examine, but if it has, follow the ABCDE method, which is the asymmetry, a regular border, the color, diameter, and elevation. I will use the another style lab, so now I'm going to inspect your lower extremities, okay? I will have to open the cover up to see your wound, okay, ma'am?
Okay.
You've got an ulceration, alright, it's pinkish and reddish in color. There's a light exudation too. And does it hurt, ma'am? Some force around it?
A little bit.
Okay, alright, I'm gonna cover it up again. Okay, I advise you to not touch with your bare hands, ma'am, so it won't get infected, okay? Next is document the findings of the client's record. So, in my patient, this is her last day of examination, and for my follow-up assessment, it shows that she is all good and normal, and the doctor decided that she can be discharged. So, I'm going to sum up everything that I've noticed during my skin assessment. So, first, I've noticed that your skin is constant or consistent all over. You don't have any unusual color of your hair, and scalp is great, moisture is good, temperature too, and hair is evenly distributed, okay? And in your face, I noticed the three flat moles with which are symmetrically and has regular borders, and which are about 2.2 centimeters, okay? And they are in the lateral side of your mandible and temporal area, okay? And I noticed also that you've got two ear piercing, one on each side, and the back and the neck is clear, no redness, no lesions, no bruises your arms, and they're good texture and good moisture, good capillary refill, good skin, turgor, it happens, and in your feet, there's an alteration in your right leg, which is about 5 centimeter in length and 2 centimeter wide, which already has a light oxidation and is reddish and pinkish in color. So now I have the result. I'm going to head out to give the doctors, and he'll be back after he's done. Okay? Thank you very much, ma'am.
Thank you.
So now I'm back. The doctor has ordered for some laboratory test for you, and he also gave me your prescriptions, okay, your medical prescriptions here. But before I go, I'm gonna have to give you some important health reminders, okay? So first, since you already have this in your feet, I highly advise you to not touch it or scratch it, even if it's itchy, okay, ma'am, because you might introduce some bacteria to it and it might get infected, okay? And you must keep it always clean and dry, as well as all the other parts of your body, such as your bony prominences, which are the back of your ears, your shoulder or your scapula here at the back, your elbow too, your knees and ankles and heels, okay? You don't massage it, so because you don't want to have a scratch, you don't want to develop another wound or ulceration, okay? And I think that basically it, and I'm done. And here are your medical prescription, and you can go home now. Any question or clarification, ma'am?
None so far.
Okay, so Ma'am Kay, thank you for your time and cooperation. I am happy that you are all good and normal now. So don't forget to do the proper hygiene and stay hydrated, okay? Thank you so much, ma'am, and have a nice day.
Thank you.
So that's all my return demonstration of skin assessment. Again, I'm Catherine Rose Pagrangan, your student nurse from Double Doctors College.